Hi, my name is Dr. Angel Brown. I'm a pulmonologist. I'm with Cherokee Lung Sleep Specialists, and this is a day in the life of a pulmonologist. So when I get into work in the morning, I sit at my workstation, I pull up my patient list, and I prep my chart. I review, see if there's any outstanding orders. I also convey that information to my medical assistant so that we can make sure patients are taken care of and there's no delay in care, and I start seeing patients. Before I see my first patient, I would love to introduce you to some of my fantastic staff. This is Kathy. She is the point of contact for the office, essentially the face and voice for this office, a jack of all trades when it comes to pulmonary practice. This is Christy Dilbeck. She's my practice coordinator. Essentially, I would not have a practice or office if not for this lady here. She is my everything in charge here. This is Jennifer, my medical assistant. She's my right-hand woman. Essentially, the medical assistant gets any records that are needed for a patient visit. She makes sure if there's any documentation that I need, that I have it in hand before I go into the room. And she also evaluates and makes sure there's no changes in the patient's status, medications, or health. Now that Jennifer's finished with the patient, I'm going to go in and say hi to Ms. Garrett. She's following up for obstructive sleep apnea. Jennifer's also mentioned that she has a new cough and some shortness of breath. It's important that we diagnose it and treat it, and we follow those patients pretty regularly to make sure that the therapy is working for their obstructive sleep apnea. So everything sounds like it should. All right, this is our pulmonary function lab. What we have here is what we call our PFT machine. This is our body box. This is unique to Cherokee Lung Sleep and Northside because not every pulmonary practice is gifted enough to have a PFT machine in-house where we can do real-time testing.
Here we go, and big breath in, blast it out. Good, keep going, keep blowing, keep blowing, keep
This machine is great because it allows me to diagnose disease as well as track disease progression and to see if any therapies I implement are working. Now that we've completed the testing, Jennifer's generated a report. She'll hand that report to me, I'll review it.
Dr. Brown, here's Ms. Garrett's results. She did pretty good during the testing. She did have some difficulty with the exhale.
And then I'll take the report and discuss it with the patient to let her know how her lungs are doing today. Now that we've completed the pulmonary function testing to evaluate the patient's shortness of breath and cough, we're going to do a 6-minute walk test. I typically will order a 6-minute walk test for anyone who complains of shortness of breath. We give the patients time to recover after testing so we can see how low they'll drop or how high their heart rate can get. It is important post-testing to make sure that her heart hasn't gotten too stressed. She had no chest pain or discomfort, and hopeful that her blood pressure has handled that activity. Northside Hospital, it's a patient-centered institution. We make sure at Northside that people have access to high quality care no matter where you live, walk of life, insurance. We make sure that patients are taken care of. Some patients need help getting to and from appointments. We take that into consideration. It's very important to be affiliated with an organization where I hear positives from my patients. If you have shortness of breath, chronic cough, if you're a smoker, any difficulty starting from inhalation to exhalation, I strongly encourage you to seek care. We have 4 offices to make it very convenient for you all, and we can always see a patient with or without any referral. This has been a day in the life of a pulmonologist. I greatly appreciate you inviting me into your home or your offices. I love what I do, and I'm always excited and enthusiastic to share that with other individuals.